You're welcome to my channel. Let's talk about Cetrizine under the brand name Zyrtec. You're familiar with this. It's over the counter, quite alright. But you need to know some facts about Zyrtec or the generic name Cetirizine. Without further ado, let's go. Cetrizine can be under Zyrtec allergy as a brand name, Zyrtec allergy children's allergy child, and so on. Could also be under the following brand names, depending on the one available in your country or jurisdiction. Also, in some countries, you find Cetrizine under these brand names. You could see laws of brand names, right? Hmm. It's a common dog that belongs to the class of medication known as second generation H1 antagonists, a piperazine derivative. Let me take you through the list of the second generation H1 antagonists. That will include cetirizine, there's phenadine, there's loratadine, and the list goes. As a matter of fact, I have a separate presentation on this very one. When do we need this? In the case of anaphylaxis, allergic rhinitis, allergic conjunctivitis, urticaria, infusion reaction, even given pre-medication in angioedema, but not the main medication and may not be that very effective. I have separate presentations, about 4 or 5 of them, on angioedema alone. Kindly check my channel for them. Can be in form of capsule for pyorrhea as hydrochloride. In that case, it will come under the following brand names. Can be in form of solution for intravenous use as hydrochloride under this brand name and strength. Also in form of solution for pyorrhea use as hydrochloride under these brand names and strength. You can always pause to check, properly. And could be in form of tablet for pyorrhea as hydrochloride under the following brand names and strengths. Also, tablet for pyorrhea as hydrochloride, you can get this brand depending on the one available in your zone or country. Then, it might be chewable as tablet, pyorrhea as hydrochloride, and it can be in form of generic that is chewable, or the brand there. Now, tablet disintegrating pyorrhea as hydrochloride. In this case, you just put it under the tongue. Well, we'll get to how to use later on, or administration. So you can get the tablet disintegrating for pyorrhea under this brand and strength. Though I'll still get to contraindications later on, but let me quickly drop this note here. In end-stage renal disease, you can say this is over the counter, I've been using it all my life, it's okay, blah, blah, blah. No. Be careful. In end-stage renal disease, don't use this medication. And if at all you are pushed to the wall, you have no alternative where you are, Then go for lowest dose possible for the shortest period of time, and then look for the pharmacist or clinical pharmacologist in your region and have that conversation. In severe hepatic impairment, you might use it, but it is better not to use it at all. You might use it, but don't go above 5 milligrams once daily. You might go below that level, but please don't go above that in severe hepatic impairment. Since it's available as over the counter, we have to be careful with the brand that is combined with pseudoephedrine, like Zyrtec D. Why that? Pseudoephedrine is a decongestant, and it can trigger loss of reactions and is even contraindicated in pediatric age group. You don't use Zyrtec D or Zyrtec with pseudoephedrine, depending on the brand in your region, the brand name. I don't know what the brand name of Zyrtec with pseudoephedrine could be in your country. Don't use it in children, please. Examples of where and when you can use Zyrtec will include generally in pediatric age group. You go for low dose, please. 2.5 milligram or 5 milligram, depending on the weight and the age of the child. If you are dealing with severe conditions, you might go for as high as 10 milligram once daily in pediatric age group. But discuss with your pharmacist or clinical pharmacologist. When there is urticaria, you can go for intravenous formulation at 2.5 milligram every 24 hours. Older kids can have 5 to 10 milligram every 24 hours. So urticaria in pediatric age group. In children greater than 6 months up to age 2 years, 2.5 milligram once daily is appropriate. In children greater than 5 years and all adolescents, you might go for 5 milligram once daily to a maximum of 10 milligram once daily. I will always go for 2.5 milligram for all patients of pediatric age group. Administration. It may be administered with or without food. Chew the chewable forms before swallowing with or without water. Still on administration, don't dilute the intravenous solution formulations. Okay, when you have the IV formulation, give IV push over 1 to 2 minutes. Don't give the injectable formulation intramuscularly. No. Don't give it subcutaneously. No. You can only give the IV solution or formulation or injectable form intravenously, push over 1 to 2 minutes. Still on administration, allow disintegrating tablets to melt in the mouth. Then you may choose to take water or not after. Mechanism of action. Zyrtec will compete with H1 receptor binding sites, and these receptor binding sites could be found along the gastrointestinal tract, blood vessels, or respiratory tract. Monitoring. Just the clinical state of the recipient will suffice. And also check for the degree of sedation and, of course, anticholinergic effects. Drug-drug interaction. Food may decrease its absorption. So it's better to create a gap between your meal and the medication per hour. Alcohol can increase the central nervous system depressant effects. So it's not advisable to be boozing while taking this medication. Pregnancy and breastfeeding. Well, if you can do without it, that is better. If you cannot, go for the lowest dose for the shortest period of time. In breastfeeding, it will be advisable to avoid its use completely. Now, adverse reactions. I've mentioned anticholinergic effects. Yes, anticholinergic effects will include blood vision, constipation, urinary retention, arrhythmias, dry mouth, hallucination, delirium, dehydration, or even hyperthermia, and the list goes on. Still on adverse reactions, alcohol will worsen the possible side effects. Remember, the CNS, the present effect. Sedation is a possibility, but when you compare the second generation H1 antagonist to the first generation H1 antagonist like Benadryl, it is less here. It is more sedating when you compare it to loratadine or fexofenadine of the same class. I have said alcohol will make the effects to be worse, right? It is sedating, but sedation here is less when you compare it to first generation H1 antagonist. There may be drowsiness or fatigue. There may be headache or psychosis, particularly delusion. Still an adverse reaction, I may be flushing, edema, chest pain, syncope, heart failure, or palpitations. Rashes, pruritus, diaphoresis, hyperkeratosis, hypertrichosis, or decreased libido. Eczema, acne, alopecia, and worsening diabetes mellitus can lead to dehydration. Other adverse reactions will include weight gain, increased thirst, abdominal pain, change in taste, eructation of belching, constipation or flatulence, nausea and vomiting, tongue discoloration, urinary tract infection with lower urinary tract symptoms, glaucoma, conjunctivitis, blindness, or polyuria. Lastly, on adverse reactions, there may be liver failure. Remember, I said earlier that in severe hepatic impairment, is that you don't use it at all, or you use the lowest dose possible for the shortest period of time and still be discussing with the pharmacist. Yes, it could be that bad. There may be lymphadenopathy, agitation, depression, tremor, or joint pain. But let me state that not all these adverse reactions will occur in one person. No. But, truth be told, some that will be on this medication for a long time might come down with this or with any of this. Contraindications: hypersensitivity to any of these medications or any component of the formulation of the brand you are using, then stop it. In the face of severe renal impairment, remember I've stated it, in end-stage renal disease, you don't use it. Now, let's examine a few warnings. We must adjust the dose when we're faced with renal or hepatic impairment. I'll not waste my time here. You can pause and rewind back. We have to consider that it has sedative effects. So, while using other sedatives, remember that it's going to form addictive effects, so there will be more sedation. In elderly, be cautious, please. We will not use this medication in anyone with respiratory illness, particularly in children. And some brands can lead to gasping syndrome in infants. In conclusion, this medication is over the counter. Yes, I got that. But you can see in the last 15 minutes, we've gone through a lot, right? It's not the type of medication you can just grab and use indiscriminately, because some may contain pseudoephedrine. And when they do, pseudoephedrine will give you, some unpleasant outcome. In fact, it could shoot the blood pressure up. Pseudoephedrine can shoot your BP up. In renal and hepatic failure, you might run into trouble. In children and elderly, please exercise caution. Remember anticholinergic effect. One of the trouble of anticholinergic effect is abnormal heart rhythm, arrhythmia. You don't want to kill yourself because you have a medication that is readily available over the counter. With that, I come to the end of this presentation. This is readily available, but that doesn't mean we should use it anyhow. Thanks for listening. Please share this with all your loved ones on all your platforms. I appreciate it.